important to know that our job as genetic counselors is to start by learning a little bit about you and a little bit about your family. And so the first thing we typically start with is talking about your medical history when it comes to pulmonary hypertension. So we'll start by asking things about the events around your diagnoses, probably want to know a little bit about those specific medical details there, and some of the ways and timing in which you came to understand this diagnosis. Next, we'll typically talk about your family history. So like we said a lot, genetics is a family affair. And so we're focused on you first, but we also want to know about people around you. And so we'll draw out this kind of picture. It's not very artistic, but it is sort of a map of your family history. And it helps us understand who else in your life kind of is surrounding you, what kind of people maybe already know they have things like pulmonary hypertension or maybe at risk for that. And that way, when we get to talking about the kinds of testing options that you have to your disposal, it helps you understand kind of how that affects both you and everybody else in the picture. The final thing we talk about when it comes to genetic testing is just going over the basics of genes and DNA, this genetic instruction manuals that make you, and the genetic instruction manuals that we want to test or check out to make sure there's no misspellings in them that might influence or be causing your kind of symptoms of pulmonary hypertension. This testing is specific to PAH, right? So we're really focusing on the genes, the specific instruction manuals that are really important in your lungs. And because of that, we're making a pretty small list and looking specifically again to figure out if we can find information that impacts your care. This information might tell us kind of why you have the symptoms or this diagnosis of pulmonary hypertension. And it will likely tell us if there's anybody else in the family who might be at risk for this kind of condition and who could be offered testing based on your results. The first thing I think is important to ask questions about are just whether or not genetic testing is the right choice for your family and for you. And so we know that, again, like we talked about, genetic testing is just one piece of the puzzle. It's really helpful oftentimes to get this information early, and as it can help your doctors, again, better take care of you as you go through your diagnostic journey, as well as through your family. When you think about if this is the right step, it can also often be helpful to understand the likelihood of finding a genetic answer, as well as what those results might mean for your family's care. And these are two good questions to speak with specifically to your genetic counselor about as they assess your personal history and family history, and they can give you a better understanding for how likely it is we find a result from these genetic tests. When you're preparing for a genetic counseling visit, it's often helpful to make sure that you have a copy of your PAH-related medical records and that you send those to your genetic counselor or your genetics team before your appointment. This just helps them be most prepared when coming into your appointment and ready to know exactly what kind of things they still need to ask you to better understand how to take care of you best. Okay. Some people like to talk to their families also before they meet with a genetic counselor. And part of this is so they feel really informed, they understand the different symptoms that are or are not in their family. So when a genetic counselor goes through and asks about your brother or your aunt or your nephew, you understand exactly what kind of information they're looking for and are able to provide information that's helpful, again, ultimately towards taking care of you and your family most appropriately. Okay. If there are other members in your family who have a diagnosis of pulmonary hypertension, sometimes it's also helpful to talk with them first to see if they've already gone through or been offered genetic testing, and if so, if they already have results from that testing. That can be extremely helpful to know about in advance and even bring those results to your genetic counseling session, just so your genetic counselor already knows what's been done in your family and what's been found or what's not been found. And this can inform the kind of testing that's most helpful for you, and again, get you to an answer faster that's going to be most helpful for your family.